We were absolutely elated. The problem was that the next day when we're diving into the detail, we realised that our ability to actually implement this successfully for the government is being rather thwarted by the conditions that they've attached to that additional funding.
$133 in the back pocket for a parent. I mean, that seems like a game changer. It allows them to go back to work or go back to training as well.
100%. Look, we want to be able to pass on that reduction in parent fees. We want to be able to do that. So the problem is we've got conditions that mean that we cannot ask parents to have a co-payment and cross-subsidise the money that we actually receive from the government for those 20 hours.
Right, so when their child is there under the 20 hours subsidised, you can't ask for a top-up.
No, that's exactly right. And the difficulty is, particularly for 2-year-olds, we are funded on a 1 to 10 basis. Now, for 2-year-olds, you can appreciate that that is simply not quality, that's not safe. And so we already staff our toddlers to a much higher ratio than that, and our parent fees help to cross-subsidise and make it affordable.
So you're saying that this funding that's being offered is on a 1 to 10 basis?
That's exactly right. And even with 1 to 10, it doesn't even cover the cost of delivering that. So we do rely on parents to help us to make that, deliver that program for them.
So are you saying that if you, as a centre manager, agreed to this funding model, that would affect a toddler's care?
Okay, so as I was saying, if we can only utilise the government's 20 hours subsidy, we would have no choice but to increase the number of children per adult, per teacher that we have. So that's not quality and that's not care at all. That is not, and in fact, it actually goes against the Early Learning Action Plan that the government has set out.
Is that the key point, that a toddler's care would not be optimal because they just don't have the teacher ratio? That is the key point?
That is the key point. The only other way we could possibly make some of these, make it work, would be to reduce our opening hours. You know, we could operate at 6 hours a day and possibly make it work, but is that really meeting the needs of our parents?
And 6 hours a day is the most that you can get in terms of that free subsidy?
Well, that's right, per day.
Per day.
In fact, that's one of the other crazy conditions that have come along with it, is that they said a parent could come and say, actually, I only want 2 hours today. Okay, well, that's lovely, but then if they wanted that between 11 and 1, how am I meant to fill that child's space between, you know, sort of 9 and 12 in the morning, and then perhaps from 3 till 5 in the afternoon?
So you're saying it's not possible to staff for small periods of time?
No.
It's not effective
because
that way?
You can imagine our teachers, we employ them all day, and so that's just not workable.
There seems to be some confusion over the funding rates. I've heard the Kindergarten Association say it's going to be like $7 to $9 per hour per child, but the government minister, Associate Minister Joe Luxton, says that if a centre opts in, it's going to be $13 an hour. Do you know which it is?
So the rates that I have seen, I thought were closer to $15 an hour.
$15 an hour.
So coming in in early next year. So the point is that even that amount of money, you know, the cost that it actually takes to run a quality early childhood service is way in excess of that.
Yeah, the Associate Education Minister seems to be pushing back. Joe Luxton says that when she owned a childcare centre, she made the subsidy work for 3 to 4-year-olds, and it should not be any different for 2-year-olds.
No, this is completely different. If I'm correct, I think Minister Luxton actually owned a centre quite some time ago. The whole dynamic has changed in this time. In fact, you know, the increasing cost for early childhood services has gone through the roof, and incredibly, you know, very much compliance costs which are coming through from government changes have made it much more difficult for services to remain afloat. And also, to say again to the point about ratios, the key aspect about why it's more expensive for 2-year-olds is because we need to provide additional teachers for quality care and education of toddlers.
If a centre doesn't like it and doesn't like the terms and conditions that come with this funding, why don't they just say, no thanks?
Because unfortunately that will drive parent fees through the roof. But that is, so we're really caught with our hands behind our backs.
Why would it drive parent fees through the roof?
So if you don't get the subsidy, and this is the other thing about another condition, which is that you can't just say, look, I'll continue to operate my 3 to 5-year-olds under the subsidy, but actually thanks but no thanks for the 2-year-olds, that's not going to work for us. It's a full opt-in or full opt-out.
It does seem counterintuitive, though. I mean, the government's throwing money at the sector, or, you know, and yet the sector says it's going to force the closure of centres. How do the two marry up?
Sure. So If we can actually implement this policy under the current conditions, it's an absolute win for everybody involved. We can do that from tomorrow. So we can already utilise the subsidy that's coming through for 2-year-olds, and we can then also ask for co-payments from parents to be able to provide additional teaching.
So why are the terms and conditions changed from 3 to 4 to 5-year-olds to 2-year-olds?
Look, we are very perplexed about that as well. I don't understand the need for it at all, and we haven't had any explanation as to why that's required. It's just unnecessary, and in fact, it's counterintuitive, as I said, to their own early learning action plan. It's also going to be, we can't then deliver and reduce the fees for the parents, and we want to do that.
How would you describe the government's consultation on this policy?
There just hasn't been any, none at all, none at all. And you know, they have we speak to them regularly. They have our email addresses, they have our phone numbers. We work closely with them. So I can't understand at all why they didn't just come and actually talk to us beforehand and say, what about this as an idea? Would this work?
So you're saying that the fees, like $15 subsidy, is not enough. So are you asking for more money, or are you just asking for consultation? What do you really want?
We don't need more money. We don't need more money. This is a huge investment in our sector, and we are absolutely thrilled. But allow us to actually implement it under the same conditions that we currently operate. It's as simple as that.
So if I'm a parent, should I feel confident under this system about the care that my 2-year-old would get in a childcare centre?
Under the current system, or under the
new
proposed?
system.
Under the new system. Oh, look. It's very concerning. It really is concerning. But at the end of the day, I can tell you that our services will simply not put children's safety at risk. That is just, and nobody, not only in Newshubs, but across the services, these are people who fundamentally care about the quality care and education of children. We are not going to put children's needs at risk. But the problem is that we're going to have to find other ways to stay afloat. That will be either through increasing parent fees, and I guess that's a conversation with parents, like, you know, what do we want to do to make sure your child is safe and well cared for, or do we reduce our opening hours? But we would have to find ways that effectively still disadvantage our families and communities.
Will centres go out of business because of this policy?
I think there's a high chance of it. In fact, if I can talk to that, I've just had the data through this morning. 719 centres have closed since June 2022. June 2022, and to give you some context of that...
That's not under this new policy, though.
No, it's not. So, but that shows you that services are already on the brink, and this is just driving us further into that space. This is not good. This is unrequired, and in fact, it's just counterintuitive to what this policy should be able to deliver.
I mean, you're a centre owner, runner, manager, but from a parent's point of view, would you put your own 2-year-old into care under this scheme? That's a really hard question. That's a really hard question. I know that in my service that I would do everything that I can to make sure we deliver quality, or I would close. Actually, to be honest, or I'd close. If I can't deliver quality for those children, then what are we here for? I mean, let's be honest. We are here to look after children. We're here to serve our families and our communities. If we can't do that properly, then what is this about? I mean, we're here to look after our most vulnerable New Zealanders. And we need to make sure that we can do that. And if that's, you know, with the government and working together to make that happen, wonderful. But if we can't deliver under these new conditions, then what's the point? Kelly Seaberg, thank you very much for your time.